Hi, I'm Rachel Miller, physical therapist, certified Pilates instructor, and founder of the Pilates PT. I want to educate you on diastasis recti. So diastasis recti is separation of your abdominal wall. It happens commonly in pregnancy by the 3rd trimester. Our bellies are bigger, the abdominal wall separates. It's just that it should come back together about 8 weeks postpartum is when I typically start to check. It can also happen though in men or in women who have never had babies. So I consider diastasis recti a pressure issue. Other pressure issues are hernias, pelvic organ prolapse. If untreated, diastasis recti can even cause some low back pain or other issues. So we want to check for diastasis recti. When we check for that, traditionally what's kind of known is you checking for width. So we're checking for how far apart is that abdominal wall. So we have this linea alba, this line of connective tissue that goes right down the center. If you think about a 6-pack muscle, we have 3 packs on each side, right? So you do normally have a line down the center. So if we were checking, 1 finger of separation is totally normal, even up to 2 fingers. Right around 2 fingers is where it starts to get a little fuzzy. So if it's more than 2 fingers, it's definitely considered a diastasis. If it's 1.5, 2 fingers, we start to look more at the quality of the connective tissue. So in general, we're looking for width, and then we're looking for depth. We're looking for the quality of that connective tissue. When you push down, you should feel your skin push back. It should feel a little bit firm. If when you're pushing down, you're just sinking and it's like this bottomless cave, that is not good quality of connective tissue. So that's just as, if not more important than the width. So we want to note both things. So here's how you check. You're going to lay down on your back. You're going to bend both knees, and you're going to bring your fingers kind of side to side like this. I start with 2. So you're just going to bring yourself down. You're going to put your fingers right above your belly button. And then you're just going to draw your chin to your chest. We're going to kind of sink your fingers down and kind of feel side to side. So you should feel a ridge on one side, a ridge on the other side. You're looking for how much width, how many fingers can you fit into that space in between. And then you're looking for the depth. So when I push down, it pushes right back. I can only go to right about there. And then you can relax your head whenever you need. So we're gonna check, we're gonna come up 1 inch or 2. Same thing. We're gonna come below the belly button another 1 inch or 2. Same thing. And we're gonna start to check. So especially if you notice that one of those areas is wider than you think it should be or deeper than you think it should be, you're gonna check all the way from here, right underneath that sternum, all the way down to your pubic bone. So you could have separation in one place, you could have separation in 2 places. There's no rules, but you wanna find kind of where is the issue. So for most women, I find it's right around the belly button. That's obviously the area that was kind of the most stretched out per se during pregnancy, but that's what we're looking for. So if you do have diastasis recti, what next? So a lot of people hear, don't do crunches, don't do planks. When it comes down to it, it's not as important with what you do, it's more important with how you do it. So if you can manage this intra-abdominal pressure, so if you're pushing out on your abdominal wall, you don't want to do it. It's putting more pressure on something that we already have too much pressure, right? So if you put your hand on your belly and you feel your belly pushing out while you're doing different activities, that's kind of your barometer of don't do it. If you can do those exercises or those activities and manage that intra-abdominal pressure, then it's okay. I know that seems really vague, but I've had women that I've seen that can do a plank and manage that intra-abdominal pressure just fine. I've had tons of women who have realized that, oh my gosh, every time I lift my kid or my laundry basket, or even doing a bicep curl, every time I'm doing that, I'm pushing out on my abdominal wall and I'm not helping to remedy the situation. So just start to kind of notice, what does your belly do when you're doing all of these day-to-day tasks? And then you want to make sure that if you do think you have diastasis recti, you're going to get it checked out. So go to a women's health physical therapist, ask your OBGYN. A lot of times physical therapy can help. There's a ton of education and there are specific exercises and, more importantly, concepts with you learning how to manage this intra-abdominal pressure that can make a difference and it can help. So let me know if you have any questions. My email is Rachel, R-A-C-H-E-L, @thepilatesptstudio.com. and I'm happy to help. Have a great day.